Series on medicine, illness, and public health. I would like to introduce our speaker for today, Michele Rivkin-Fish. She's an associate professor of anthropology at UNC Chapel Hill, whose research focuses on reproduction and demographic politics, gender, and doctor-patient relationships in Soviet and post-Soviet Russia. She is the author of numerous articles and a 2005 book, Women's Health in Post-Soviet Russia, The Politics of Intervention, which won the Basker Prize for Outstanding Research on Gender and Health from the Society of Medical Anthropology. Her talk today will discuss her most recent book, Unmaking Russia's Abortion Culture, Family Planning and the Struggle for a Liberal Biopolitics, published in 2024 by Vanderbilt University Press. Michele, welcome.
Thank you so much. It is such a privilege to be here, and I want to thank everyone for coming. My talk today tells of a silent revolution in the intimate practices of everyday life, whose enormity can be glimpsed through statistics. So in 1967, for every 100 live births, there were 293 abortions reported. There were more, but these were the officially recorded ones. In 1992, Russia still had among the highest abortion rates in the world at 216 per 100 live births. And by 2022, that rate had gone down to less than 39. What this means is that the average Soviet woman in Russia had between 4 to 5 abortions during her reproductive lifetime, but some women had many, many more. And even though abortion was legal, many sought illegal terminations because abortion was provided in assembly-line conditions without privacy, and sometimes without effective anesthesia. Moreover, it was provided through the invasive dilation and curettage methods under poor conditions, which often resulted in uterine scarring and sometimes secondary sterility. Now, in 2022, more than 70% of pregnancies resulted in a childbirth. And since 2007, the number of births have annually exceeded the number of abortions. So this is indeed a huge revolution in reproductive life and in many aspects of Russian society. What I want to do today is talk about several themes that will explain how this revolution took place, what enabled it, and what the challenges have been to it with the rise of the illiberal, nationalist, and patriarchal movement to squash family planning. So the routine use of abortion was called an abortion culture by the Soviet researcher Andrei Popov, who coined the phrase in order to critique it. And Popov talked about an abortion culture as the embeddedness, the systematic use of abortion in the healthcare system, in everyday life, that abortion was the main system through which the Soviet Union enabled people to control their reproduction. I argue that the system of relying on abortion for fertility control emerged from contradictions that were inherent in Soviet biopolitics, which included the state's socialist ideologies about sanitary hygiene, which I'm going to talk about, the state's failures to actually fulfill its material guarantees of it promised to provide all the things that people needed for basic life, and it did not, and the censorship that deprived people of accurate information regarding how to prevent unwanted pregnancy. I want to show how the process of unmaking Russia's abortion culture enables us to see processes of shifting modes of governance over the 30 years since the end of the Soviet Union. The transformation from a reliance on abortion as fertility control to the use of contraceptives did not just occur automatically when the market made contraceptives available. It was a very multifaceted, complex, systemic set of transformations in professional knowledge and practices, in the organization of clinical services, and in expert relations with lay people. I will talk about both the rise of family planning and the way that this was part of and even led a series of liberalizing biopolitical reforms in the 1990s, and then the demise of family planning organizations that began actually pretty much as soon as they started in the 1990s, but that really dismantled the organizations that were created in the 20 teens. So my goals today are to describe the abortion culture and explain to you what caused it, how it arose, and what were the efforts undertaken to unmake it, both in the late Soviet and early post-Soviet years. I want to explain how the state and nationalist pursuit of higher fertility impacted the creation of family planning organizations and work. And I want to suggest what this case study of the rise and demise of family planning can teach us about the broader development and fate of liberalizing social change in contemporary Russia. Okay, so part one is the abortion culture and Soviet biopolitical efforts to fight it. And the fight against abortion is from the Russian, that was the Soviet language. So I want to start with Maria Arbatova, a writer who describes herself as a feminist and liberal, who talked about her own abortion experiences in several of her memoirs. I'm quoting here from her 1998 memoir, My Name is Woman, Меня зовут Женщина, when she was recalling her first termination at age 19. And she describes the atmosphere that she sees: an industrialized workplace drudgery, women waiting, glancing in a businesslike way at their watches, thinking about what other household responsibilities they'll be able to fit in today besides an abortion. The tired, angry nurses, the screaming from behind the closed door. It's evident from people's faces that everything is proceeding correctly. Adults are properly undertaking their adult business, and only I, an infantile fool, feel the events around me in the genre of tragedy. Now, Arbatova is an interesting character, and this statement is quite evocative. What she's telling us here is that she looks at abortion as an experience of tragedy and deprivation, rather than an empowering experience in which she gets to realize her choice and her goals for her life. In fact, the routinization of abortion and the lack of alternatives for controlling your fertility meant that abortion was often talked about as a symbol of people's lack of choice in the Soviet era. It was not, importantly, moralized. It was not seen as murder or a sin or any kind of moral transgression, but something akin to a root canal, an unpleasant solution to a practical problem that has to be taken care of. In the narratives that I've studied in women's fiction writing and memoirs, it often is seen as an outcome or a signifier of people's failures to care, the state's failures to care for its population by fulfilling its guarantees for social welfare, men's failures to take steps to protect their lovers' health, and mothers' and doctors' failures to teach women about how to successfully prevent pregnancy. How was the Soviet abortion culture made? Well, the Soviet Union was the first country in the world to legalize terminating pregnancy in 1920. It used a rhetoric of women's emancipation, but basically it meant that women should be emancipated from the home to go out into the workforce. Women needed to be able to work, to build the industry, and to become workers. So emancipation was really understood as mobilization, not reproductive autonomy. And in fact, there was no commitment to women's autonomy in a reproductive or any other sense. And in 1936, Stalin criminalized abortion with the expressed goal of raising fertility, which of course failed, but it did lead to high rates of maternal mortality. As soon as Stalin died, the Khrushchev regime legalized abortion, but announced immediately that they would fight against it. To stem maternal mortality, abortion needed to be legal and safe and provided in medical institutions, but the goal of the state was to raise fertility. And to that end, there was a very lukewarm interest in promoting contraceptives. In fact, there was some push for contraceptives, but there was also a continual worry that if people were effectively preventing pregnancy, that they wouldn't have the ability to raise fertility and replace the dead from the Second World War. So this was a classic Soviet paradox in which they're going to fight abortion even as they are expanding its availability. I want to talk about how this fight against abortion made use of the tools of Soviet biopolitics. And part of my argument is very much that we have to distinguish between the Soviet form of biopolitics and the liberal form of biopolitics that emerged at the very end of the Soviet era and in the 1990s. And we can talk later about that argument if folks are interested. But within the Soviet public health framework, the understanding of how to approach public health was through the idea of social hygiene. Social hygiene is a worldview that says health is shaped by environmental conditions, and the state is obligated to provide all the material conditions people need to be healthy. And of course, in the Soviet Union, the state declared that it had done so, and therefore any residual illness or health problems were obviously people's own fault for not becoming enlightened enough and not following the correct behavior because the state had done its role. Of course, the state did not do its job, it did not fulfill its promises, and there was a deficit of all kinds of things people needed for health, including contraceptives. But the second prong of Soviet biopolitics was sanitary enlightenment, which was envisioned as an educational process going from experts to lay people in which ordinary citizens would be instructed how to live properly, how to behave properly. And Fran's book is a very important classic now for the earlier era of sanitary enlightenment and social hygiene. And this continued throughout, even past the end of the Soviet Union, the notion that experts need to inform people how to live properly and how to behave themselves. The other prong of Soviet biopolitics concerning abortion and contraception had to do with Marxist-Leninist population theory, which basically said once the state has provided all the material necessities of life, people should not need to and should not really do much to control their fertility. They should be able to have more and more children. And in fact, the assumption was that people should have more children. And if they're not, then they need to be enlightened in order to successfully do so. Now, these contradictions, these ideas about how to make a healthy society and the failures of the state to actually achieve social hygiene's ideals, as well as the one-way direction of sanitary enlightenment, where the experts never needed to listen to or understand the ordinary population, but just instruct them how to behave, generated the set of contradictions that led to the abortion, in part, the abortion culture. I have found that there were several different ways in which socialist scientists and health experts tried to use socialist biopolitical approaches to fight abortion. Some of them, the more liberal, if you will, wanted to promote contraceptives and to argue for improved living conditions. And they did a lot of discussions about how contraceptives could be ideologically compatible with socialism. The larger context here is that in the 1950s, the United States was using contraception as part of its population control efforts in the developing world to lower fertility. And the Soviet system, the Soviet worldview was very much against this because it refused the notions of social hygiene and the notions of redistribution of resources in it for equity, right? So contraceptives were seen as a very problematic tool in the arms of Western capitalists. But this one group of socialist health experts said it can be compatible with socialism because we are addressing equity and we have a socialist economic system. They also, however, said we need to raise fertility, and that will happen as people's living standards improve and they have their own apartments, for example. The material obstacles need to be removed and people will have more children. And we need to maintain women's right to abortion in the case that they cannot have another child. The other group of socialist biopolitical experts who were trying to fight abortion did so by basically saying, let's persuade pregnant women to give birth, regardless of their interests. Just push them to know that abortion is bad, it's bad for their health, and they should have the baby. And in fact, over time, as bureaucrats and health experts realized that contraceptive supplies were remaining in deficit, they increasingly moved to persuasion tactics as the kind of last resort. There was no real sense that there was any other way to reduce abortions except to convince women not to have them. Just a few examples of what the sanitary enlightenment literature and efforts looked like. It was often focused on scare tactics. So this booklet is from 1964. It's called The Harm of Abortion. Lots of focus on all of the terrible things that can happen to you, but also a lot of emphasis on how great the state is for women mothers and how joyful motherhood is, and sort of this real focus not on contraceptives, but mostly on in persuading people to have children, whether or not they wanted them. This is an example of a diagram for how to insert a diaphragm. But as you can see, it's not a very easy to follow thing. It doesn't even acknowledge that diaphragms were in immensely big deficit, and they only came in a few sizes that didn't fit all women. So it was kind of lots of omissions. There were errors in this literature. It was not, whatever existed in terms of information was not very user-friendly. Moreover, socialist biopolitics and sanitary enlightenment figured that people needed very little information. So it gave these hard to understand diagrams, but even said people need to know the minimal amount of information and basically need to understand that abortions are harmful. And there were lots of similar scare tactics. In general, contraceptives in the sanitary enlightenment work in the Soviet era were always problematized, were often problematized and always medicalized. So in this case, the statement is, if for some reason a woman doesn't want to have children, she needs to know how to prevent pregnancy. This is a kind of suggested, or it implies that it's not a normal thing to want to control your fertility, but that there's something unusual here. And then it medicalizes it, saying you must go to a doctor. You cannot choose them yourself. Now, interestingly, in the 1970s, the demographic experts and others were worried that there were high rates of divorce and fertility was not rising. And one of the issues that arose was the notion that people are getting divorced in part because of unhappy sex lives. And so some contraceptive discussions started to emerge in discussions about sexual harmony, the importance of sexual harmony for marriage. But interestingly, it was generally filled with errors and omissions, and also focused on ensuring men's pleasure in sex rather than really caring about women's interests, whether it was sexual pleasure or women's personal needs. And so in this one book I'm quoting from 1979, it not only says IUDs would be very good so that women don't worry about getting pregnant and, the sexual harmony is preserved. But also the husband should not be responsible in any way or even know about how a woman would be contracepting. So just to summarize, I'm arguing that Soviet biopolitics governed abortion through a series of contradictions that led abortion to be the main form of fertility control, even as the government was trying to fight against it. There was literature in which social hygiene was celebrated for guaranteeing people the needs of everyday life, but it didn't provide them. There was a broad availability of abortion, but it was done in poor conditions. There was no privacy, and oftentimes physicians treated women with very punitive interactions and a lack of anesthesia. There was continual sanitary enlightenment work against abortion, trying to convince women not to have the abortion, to have a child, whether or not they wanted it. And there were deficits of both contraceptives and information about preventing pregnancy. I want to move on now to looking at how, in the era of glasnost, things began to change quite dramatically. And these were the biopolitical reforms that enabled liberalizing ideas to be introduced. And I want to highlight the visions of the Russian family planning experts, their projects, and then how pronatalism impacted their work. So one of the most interesting things is that the earliest times, the earliest late 1980s and very early 1990s, was a time of immensely progressive ideas compared to what would happen later. So it wasn't just that information about contraceptives or sexuality could become available, but actually new understandings of the role of experts in ordinary people's lives became possible. And in fact, family planning advocates wanted to revise and remodel what it meant to be an expert in order to both to be more effective in their work, but also to raise their own authority and legitimacy in the aftermath of the Soviet era. And they hoped and they believed that becoming experts in the family planning would be that a route to becoming, having better authority and more legitimacy. This is the cover of one of the first, if not the first, booklet of how to prevent unwanted pregnancy in this new biopolitical era of liberal techniques for empowering people with knowledge to steer their own lives. And this booklet was written by Andrei Popov, who was the person that I spoke about in the beginning, who coined the term abortion culture. And his ideas were very much to change expertise as well as help people to change their reproductive practices. Before I go on, let me just say what Popov did was he normalized the process of controlling human reproduction as a universal process. And that was quite different from the Soviet sort of messaging, which was if for some reason a woman doesn't want to have a child, which was again seen as odd and somehow not normal. Popov says everyone controls fertility. The question is whether you do it through abortion or through preventing unwanted pregnancy. Moreover, Popov did not mention anything about the state policies, or fertility. He deemed demographic issues and fertility as irrelevant to what people needed for caring for their health. In this way, he saw scientific knowledge as apolitical. This was a key element of liberalized biopolitics, was the idea and the aspiration for scientific knowledge to be given to people without political agendas for how they should live their lives. And so this book, which is titled How to Prevent Pregnancy Safely and Effectively and Conveniently, was a book that really just gave information about types of contraceptives, their advantages, their disadvantages, both for preventing pregnancy, but also their effects on sexual pleasure. Popov addresses a male reader. He tells men to take responsibility for their partner's health, to care about women's sexual pleasure, and he provides a chart for readers to figure out the best contraceptive method for themselves, rather than, as we saw in the earlier Soviet era book, that a doctor must decide. So to summarize, what this model of family planning offered a new approach of expertise, which involved providing options, not commands, trying to separate science from politics by giving people information that was scientifically valid without telling them how to live, used a friendly tone, was compatible with humor, as the cartoons suggest, and it was also concerned with the emotions that people have around their relationships, around their sexual and reproductive lives, and really directly promoted care, care for women, care for the children that would be born so that they would be born wanted, and care from doctors to be shown towards patients, that they should care about their patients' wellness. And in fact, Popov's language in this text is very much using both a friendly tone, humor, and arguments that he cares about his readers. So I see this as a very important stage, a kind of almost a pinnacle in progressive liberal ideals about experts between of relationships between experts and laypersons and women and men. Now, what happened in the early 1990s was that a series of family planning institutions, organizations were able to be founded. And these happened in the early 1990s. They were supported by Yeltsin's government. A good amount of money was devoted to transforming what had been abortion clinics into centers for reproductive health and family planning. And I studied in the book two particular organizations. One is a teen clinic that focused on providing abortions, but also preventing abortions through routine contraceptive use and sex education, that was in St. Petersburg, which did a lot of training of physicians that came from all over Russia to this center. And so that's a clinical and educational center. And then an NGO called the Russian Family Planning Association, which was funded by and given lots of support by the IPPF, the International Planned Parenthood Federation, which worked to re-educate physicians about contraceptives, particularly about the pill, which what had been highly blasphemed and was not available to the Russian population until the 1990s. And we can talk about that in the Q&A, but to teach physicians about both hormonal contraceptives and other forms and how to counsel clients in preventing pregnancy. Now, what's interesting here is that as these organizations got underway, for the most part, they were not as progressive as Popov's model. These organizations, the leaders of them, often talked about the need to raise fertility, to strengthen family ties, to strengthen marriages, and they were a fairly conservative, if liberal, approach to preventing unwanted pregnancy. They always said abortion needs to remain safe and legal, but they really wanted to kind of discredit abortion as a form of fertility control. In sum, I argue in the book that Russian family planning emerged as a very specific kind of liberalism that spoke to the cultural concerns of the abortion culture and the sort of problems that people saw in Soviet life. So Popov and these other family planning leaders often talked about their two goals as rationalizing society by ensuring that steady supply of up-to-date contraceptives would be available, people would have knowledge about their appropriate use, the global science, and that they would think ahead and rationally manage their bodies and their family formation in order to have children that they wanted when they wanted them and that they would love. And that goes together with this idea of re-enchanting social relationships, so that the additional and important goal that family planners had was to promote practices of care, both between doctors and patients and between and within families. And this I would say these goals of rationalizing society and re-enchanting social relationships around care were much more prominent in the messaging and in the values of family planning leaders than the goals of reproductive autonomy and individual empowerment that we see in Western pro-choice or reproductive rights campaigns. This is all very interesting and important to me because it it suggested at the time, as I was studying this through the 1990s and 2000s, I thought the Russians are taking ideas and thoughtfully adapting global ideas and values to their own culture, their own social needs. And I thought they're doing it in a pretty strategic way because they're trying to avoid being criticized for being anti-family. They're trying to have this moderate liberalization. But I was wrong, and the nationalist illiberal movement didn't care at all and didn't believe in what they said, and they ended up attacking them almost immediately after these organizations were founded. In order to understand what gave them so much strength, we need to look at the demographic crisis that emerged. And this is just a small part of it, but basically, Russia's total fertility rate is a number that is all the time in the press, and it was in the press from the very early 1990s. Sort of how, and this is an artificial construct that is the average number of children a woman would have over her reproductive lifetime. Obviously, no person can have 1 point something children, but this is an average, and so this is an artifact that gives us a sense of how close is the number to 2 or more than 2. The 2.10 is this magic level at which the population is reproducing itself through fertility. And Russia has not had that number since actually the very, before Glasnost started. But in the 1990s, what you can see is that this number went lower and lower and lower. So in 1997, it was down to 1.2. And then in 1998, the ruble collapsed again. It went in 1999 down to 1.16. This meant that very, very few people were having more than one child. And it really created an immense degree of moral panic and politicization of both abortion and contraception. And contraception was targeted by illiberals and nationalists as a Western plot to reduce Russia's fertility rate even more and as a kind of soft power mechanism to decimate Russia's population. When Putin came to power, one of the first things he did was say that the demographic crisis was one of Russia's biggest problems. In 2007, he launched his maternity capital program, which tried to give financial incentives to people to have more children. The economy rebounded a little bit and fertility did rise some, but it has not gone beyond 1.5. So it's but the demographic crisis has continued to be a serious source of moral panic in which abortion, the needs, the campaigns to limit abortion and to defund and to delegitimize family planning have continued. And in fact, they've taken a great deal of strategies from Western anti-abortion movements, including the protests outside of clinics that are disruptive. They have taken a lot of the required waiting periods and counseling. They take the playbook and the scripts right from the West, and then they add their own, that the Russian Orthodox Church is central to developing this. And I will say that what they have done is to not only argue that abortion is a sinful practice held over from the Soviet period and that a revival of orthodoxy is needed, but also they've attacked individual family planning advocates as accusing them of corruption and being stooges of Western agents that are harming the nation. They called them traitors. There was an immense amount of attack both against individual family planners and against the institutions that were providing contraceptives and sex education. And this, of course, is deeply worrisome in the context of all the larger political illiberalism going on. I want to kind of wrap up my talk, but I still have a fair few important things to talk about. So I want to briefly mention how family planning institutions and advocates responded to the conservative campaigns, and then I want to suggest what this case study teaches us about the broader fate of liberalizing social change, and then we will open it up for discussion. So the family planning advocates went on the defensive. They emphasized that their goals were promoting fertility, promoting the birth of wanted children, and strengthening families. They really moved away from defending abortion as any kind of choice, although they always said it must remain legal, but they said we are against abortion, we are in favor of children and families. And they changed their names to avoid the phrase family planning, which is now considered an unacceptable term. It's associated with, again, the Western scheming to harm Russia. They tried to really create messaging that would legitimize themselves in the view of the conservative and pronatalist leaders. And so here you can see two important protests on the streets. This took place in 2011 when a series of very strict abortion restrictions were proposed. And the slogan that this feminist organization, it was a conglomerate of the Russian Association of Population and Development, which was the NGO after it got rid of its name, Family Planning. It called itself Population and Development, joined together with grassroots feminists, and they used the slogan, fight abortion, not women. And what they meant by fight abortion was provide contraceptives, make sure they're available cheaply and accessibly, and make sure that people have alternatives. But of course, the very notion of fight abortion is an invitation to the state to interfere in people's private lives. And so this was a very interesting moment where it wasn't clear that a Western feminist liberal view about privacy and keeping the state out of your personal life was going to develop. And even these young women here, their signs say, we are against abortion. Every child should be wanted. So the effects of the abortion culture and the antipathy to abortion continued very long historically to make people uneasy about saying abortion is a right and is a choice and it's nobody else's business. It was in 2015 that I started seeing liberal slogans and liberal ideas about privacy being finally talked about. So this is Moje telo, moje delo, my body is my business. And this was from 2015. Young feminists started using this kind of language. Unfortunately, the Russian Association of Population Development was named a foreign agent in 2016, even despite the fact that they no longer were getting funds from global reproductive rights organizations. And so they had to stop their work. And all of their branches around the country also closed down. So there is currently no NGO working for reproductive rights and family planning. There are, by contrast, lots of Putin-funded NGOs or gongos, I guess, that are promoting family values and kind of anti-abortion messaging. In fact, since the war with Ukraine, anti-abortion messaging has become militarized and is very closely connected with promoting the Z culture and the war in Ukraine. These are two different, you can see the messages. It says, defend me now, defend me today, and I will defend you tomorrow. And it's, we don't, and the one on the right is, we don't throw away or get rid of our own, and that they are comparing that between a fetus and a soldier. before I move on, I just want to say one of the key questions is what effects are these changes, the dismantling of family planning, the promotion of this kind of aggressive, militaristic, anti-abortion messaging having? When we look statistically at the changes in when women are giving birth, we can see that increasingly people are giving birth at later ages and fewer are giving birth in teenage years. So comparatively, more and more people are waiting to give birth. They're getting their education, they're traveling, they're figuring out their own life for themselves. They're living a neoliberal consumer life, which is saying, I'm going to have my own choices. And I don't see, these statistics suggest that people are not going to be jumping on the have lots of children bandwagon, but of course, more research needs to be done. So just to conclude, I'm arguing in this book that the rise and fall of family planning institutions reveals significant insights about the emergence of liberalizing social change and its fate. So Russian family planners implemented their own visions of liberal healthcare reforms, drawing on global connections, but thinking about it as they found it to be appropriate for their culture. And I'm arguing here against Krastev and Holmes, whose book, The Light That Failed, I take very seriously. I think it's very interesting, but they kind of say that the Russian leaders never were interested truly in democratic change or liberal change. And I would say, well, if you look not at the political leaders, but at this mid-level of public health experts, they indeed were, and they thought carefully. They didn't just imitate or pretend to be interested in liberalism. They worked creatively in their own terms to try to implement liberal changes. And the illiberal nationalist campaigns that have dismantled these organizations help us see that what's going on at present in Russia and elsewhere for the illiberal nationalist campaigns are very much about trying to achieve demographic and sexual sovereignty, which should be understood as patriarchal control over women's bodies and lives. And that, I think, is often absent in some of the discussions about illiberalism and nationalism, and also about population and demographic change. So with that, I will close, and I look forward to your thoughts and questions.
Thank you, Michele. That was absolutely fascinating, and I'm sure we have lots of questions. Let me just start out from one that was put in the chat quite a while ago from Mark Silber. How reliable are the statistics from Soviet and/or Russian times?
Yes. So during the Soviet era, there was a lot of concern that the statistics were falsified and incomplete. Recent demographers have said they're pretty legit, that they feel comfortable using these statistics. And I'm drawing on the work of people from the Higher School of Economics and the Institute of Demography, named for Anatoly Vishnevsky, who are experts who are very much in sync with global discussions. And they're saying, we believe that these statistics can be trusted from the Soviet era. Now there are changes in the statistics more recently that are problematic. The statistics today are problematic. And that's in part because the Ministry of Health is now bringing not just abortion as a category, but they include in what is under the label abortion also miscarriages and ectopic pregnancies. So the number of abortions that are reported is really a conglomerate of many kinds of pregnancies that are terminated for a variety of reasons. And so the number of people seeking induced abortion is quite lower than what we see. So, and then they're including Crimea in there. So the statistics are problematic today more than what we thought perhaps in previous years about the history.
Any other questions, folks?
Michele, just so you know, your video is off. Just want to
My
make
video
sure.
is off. Oh,
Yes.
thank you.
You're aware. Okay, there we
You
go.
are.
Okay, thank you.
So, Michele, there's a question here from Tallulah Richards. In reference to the material scarcity of contraceptives in the Soviet Union, to what extent would you say this was related to economic and productive shortages versus an intentional ideological decision to restrict birth control from women?
This is a great question. Thank you. So on the one hand, yes, contraceptives like toilet paper and tampons and body soap were in deficit because the planners didn't think much about human needs on an everyday life. They were more interested in the military. But there's also evidence that I show in the book that there was a continual reluctance to promote contraceptives at the, especially the pill, because they were effective. The pill was so effective, people were scared. People, meaning planners, some planners were very scared that if the birth control pill became widely available, that it would be very effective and would suppress fertility. And so there was sort of some move, not even when the health experts knew that the pill was safe globally in low levels of hormones, they didn't want to make it available. So it was both. It was both general shortages because the Ministry of Health experts in women's health wanted there to be more abortions, more IUDs and condoms, and they kept demanding that these get more imported, and the planners wouldn't do it. So it was both that planners wouldn't, and there was this real fear over the pill.
Okay, our next question is from Olivia Puzio. In what ways, if any, did you see this specific type of liberalism being carried through and evolving in Soviet satellite states such as Poland, even after their transition away from socialist ideology?
So Poland is a fascinating case because Poland had access to the pill and had relationships. The Polish family planning experts had relationships with Western European and British in particular family planning experts during the socialist era. West Germany had pills. There was not the same kind of anti-contraceptive ideology in other parts of Eastern Europe under socialism. So this is a really sad and really tragic situation because on the one hand, there was this debate of we need to have more children, and some of the, as I presented in the beginning of the talk, some of the socialist health experts said contraceptives can be compatible with socialism. We need not, deny people them. But and Poland is a great example of how it was compatible and the government imported them. But in many cases, the Soviet leaders were steadfast, stubborn against contraceptives.
Okay, this is from Catherine Young. I recognize that this isn't the focus of your research. Can you shed any light on how attitudes toward disability termination for non-viable pregnancies, medically indicated abortions, differed from or dovetailed with the larger trends you've been discussing today?
So there was a very widespread medically driven argument that if there is any kind of medical, any fetal anomaly, that one should terminate the pregnancy. And children that were born with disabilities were often, the parent was encouraged to abandon them in an orphanage. And this was a kind of unquestioned process throughout the Soviet period, and even continuing into the 1990s. I saw this myself during my field work. This has been changing over the last 20, 25 years as parents have said, we care about our children. We are not anti-disability, and we're going to love these children and care for them. And there is a disability rights movement, as your work, Fran, has shown, and the work of Cassandra Hartblay and Michael Ransell and others has really developed. And it's also impacting people's decisions around pregnancy and keeping children that are born with disabilities.
Okay, from Melissa Miller, I wanted to ask, given Russia's war against Ukraine and the barriers to collaboration this presents, how do you see this line of research continuing into the future?
This is a great question. I am trying to continue to look at the impacts of this pronatalist ideology and propaganda on ordinary people. I'm tracing it in websites and in social media to the extent possible. I'm looking at the various ways that people are criticizing pronatalist ideology. I mean, right now we still have access to YouTube videos or videos of Kontaktia that are, people are making fun of the continual pronatalist policies. There's currently, they've made the ideology of child-free illegal in Russia, and they are prosecuting people who are even mentioning things like, oh, I don't have children and I'm happy, as propagating child-free propaganda. So the way in which this is being received, these pronatalist aggressive policies are being received, can still at this point be accessed by reading against the grain, reading the irony and the humor in ordinary people's posts. But it may start to change because people are scared. They're really scared that their posts are being read and they may be prosecuted. So I'm trying right now. We'll see what happens.
Other questions, folks? Okay, here's to what degree, again from Mark Silber, to what degree are the policies fashioned to promote Russian white versus minorities?
So this is a very important question. There is, of course, a higher fertility rate among the Muslim communities in the Russian Federation. And in fact, if you look and across the Russian Federation, the regions have different degrees of low fertility. But the propaganda, the photos of have more children are always with white European looking children. There's a lot of push for the ethnogenetic pool. That's what it's called, the ethnogene pool, which is a way of saying we want Slavic blood and Slavic looking people. So they're not coming out directly and saying it, that we don't want the Muslims to reproduce, but that's, everyone understands that that's what is being talked about. Yeah.
This is a comment from Michelle Birdie. I was the Russian in-country director of a big communication program on family planning. I'd only add that it was funded by USAID, which meant that we all, the contractors and our Russian counterparts, had to take that into consideration in our communication outreach.
So at the time, Michelle, I'd like to ask whether you were able to, was that during the era when there was the global gag rule and you couldn't talk about where to get abortions, or was there an openness about that? Because during different periods of the US administration, USAID was able or not to say different things.
Well, I wouldn't say that there were things that we absolutely couldn't say. The problem with abortion was also that it was, because it was done so, gruba. I mean, it produced very higher than average infertility rates. And there was also the problem of men who the problem there with male infertility was that they didn't want to go to a venereal clinic. So they would, if they came down with something, so they would go to like a dentist friend and get whatever antibiotics he could hand to them. So that the idea was that family planning was going to help people stay healthy and then be able to have as many children as they wanted. And that was partially absolutely true. And that was a fair thing. And we spent a lot of time working with GYNs to help them get counseling skills, because they had no idea that you would actually ask a question, and where do you live? And are you in a communal apartment? Do you have access to water? Can you get up in the night and put a condom on or put a diaphragm in, etc. They had, so there was an awful lot of work on that. But then we always had to have the natural method, and that people were advised to ask about religious beliefs, etc. And when later on, when the Clinton administration left and the Bush administration came in, I would say that we were all just very careful to make sure that all of that was made clear that this was a choice and something not being foisted upon people, etc. But it also just really depended on the people at the local levels. Like we had 7, I think, regions we worked in. And of all of them, Ivanova just took it and ran. And if you probably go back and look at statistics, you'll see they have much better statistics on both venereal disease and abortions, because they were so good at outreach and going on television and talking about this.
And what I'll say, thank you so much. I'll say that these family planning clinics were very important for exactly the reason you said, that men were able to go to them. Whereas the earlier Soviet models of the abortion clinic, which sometimes tried to give contraceptives, but it was only for women. And so
Yeah.
one of the major changes that happened with the family planning movement was opening the clinic to welcome men and teenagers. That was a huge thing. And you're also right that different regions went in different directions. So Udmurtia was a center of training doctors in family planning. And you know, even doctors came from Moscow to Udmurtia to learn about how to do contraceptive counseling that the Russian Association of Family Planning was supporting. So the changes were extremely important, and what's also relevant to know, everyone, is that they achieved their goals. They brought down the abortion rate. They made abortion no longer the main form of family planning. Contraceptives are now a routine practice.
Yeah.
But the anti-abortion movement has so discredited family planning that it's really unclear what's going to happen going forward, because you're not having the training going on. There's some indication that access to contraception is being compromised due to the sanctions, even though it's not supposed to address medical medicines, but contraceptives may be stuck in logistical problems due to sanctions. And there's no promotion of preventing pregnancy rationally. So I am kind of worried about whether, even though a revolution has taken place, what is going to happen going forward with this regime of illiberal nationalism. It's really unclear.
Yeah. Yeah, I remember sitting in my kitchen in Moscow after I'd left the program, and it was like 2007 or 8 or something like that. And there was some talk show, and they were talking about having that USAID had been there trying to keep people from having babies in order to destroy the Russian public. And I remember thinking, okay, that's over now. We can but people did continue on. And in particular, you're absolutely right that there were male doctors, male GYNs, who were trained to talk to teenage boys and to talk with husbands. Later, there was also a program for childbirth where maternity hospitals started letting in people waiting in the door, and you didn't have to stand outside and sort of scream, Masha, have you had the kid yet? Husbands were allowed in. And that also took forever. They were just very, very skeptical. The doctors just couldn't. They were just worried that their systems were not as sterile, and that sterility, this idea that sterility was actually a hindrance, we don't want things that sterile, was just very, very hard. But, again, it depended on who was in charge of the health department in a city. Sometimes the smaller cities were much more effective than the really big ones. But I'm dying to read your book now. You really hit on all of this stuff.
We should talk at another time and see just if there's any other questions.
Yeah.
Michele, I had a question for you, either during the Soviet period or after. Is there ever any efforts to promote adoption?
So there was not during the Soviet period. In fact, children who had been left in an orphanage were seen as somehow stigmatized and not. People wanted their own children, and they made that as a term that other children are other. But in the more recent decades, there has been a move to develop foster families. There is more adoption happening. There's still some secrecy. People don't always tell their child that they were adopted. They sometimes fake pregnancies, but the fostering system is developing. There's been some research about that with Mary Kumala in Finland and Jana Chernova, but it's still not the open under sort of the celebration of adoption that we have in the West isn't still not really happening.
Great. This is from Caitlin Weber. Were any forms of pseudoscientific myths being circulated around surrounding abortion and the medicine surrounding it, either at the everyday people level or political? If so, do you think that it was significant enough to have any effect on everyday culture, or were they widely recognized as myths anyway?
Well, these are very good questions. There was a lot of propaganda by the state that abortions will lead to their, infertility. It didn't always lead to infertility. There were some cases where the uterus would be perforated during the dilation and curettage process, but there was this kind of constant, if you have an abortion, you are never going to be able to have children. So that was one thing. And people were afraid of that, but they often decided, I'm going to make my decision based on what my situation is. There were also, sometimes it would say that you have a higher rate of ectopic pregnancy or other problems. People didn't necessarily focus on those arguments, but the pill was seen, the myths around the pill were very problematic, because when the pill was first created in the West, there were very high doses of hormones in the early 1960s. And in fact, there was a series of, I talk about this in the book, how in both the United States and Britain, there were citizen activism to really protest the harm that the oral contraceptive was leading. But soon thereafter, companies started reducing the rates of the amounts of hormones, and the lower dose second generation pills were much safer. The Soviet Ministry of Health never talked about second generation pills. They called oral contraceptives hormones. They said terrible things will happen. They're very unsafe. And those were myths that doctors and patients widely accepted through the late 1990s. It took a long time for these family planning, the NGO that I mentioned, the Russian Association of Family Planning, to really convey to doctors that we're talking about a different kind of oral contraception. So the process of disabusing people of the myths about contraceptives was a bigger job and a harder task than getting people to sort of see abortions as safe. Especially when vacuum aspiration became more widely acceptable and available, because the vacuum aspiration is less invasive.
Mm-hmm. Mm-hmm. More questions, folks?
I would love to hear from anyone if you have questions or thoughts, and I'm always welcome. I always welcome your feedback and questions. So thank you so much for being here.
No? All right, let me just announce our next talk, if I can find it. Okay. April 21, we will be hearing from Elena Pedigo-Clark, April 21 at noon. And the presentation is titled Trauma and Truth, PTSD, Trauma Theory, and Literature on the Chechen Wars. And that will be announced on the Jordan Center website as well. Thank you so much for coming. And thank you, Michele. This was absolutely wonderful. Take care, everybody.